Hello and welcome to my channel. My name is Dr. Tina and today I'm discussing with you various paths of nursing, the degrees one can achieve, which school to apply to, and your decisions on choosing this path. So I'll be referring to my sheets over here that I have done a little research so that to help give you these information. So before one become a nurse, you have to choose specific program that fits you. Is it the CNA that fits you? Is it the LVN that fits you? Is it associate or the bachelor's? So before you choose a school, you have to decide which one best fits you. Now, we have so many degrees one can achieve as a nurse. And some of these degrees, I'm going to refer to my sheet up here. So we do have nursing diplomas. So nursing diplomas like community colleges and vocational schools. So you can go in to achieve an LVN or LPN diploma so that you can work as a nurse. Or associate degree nursing, which is the community colleges offers those, and that is the 2-year college. If you have watched the previous episode, I talked more into detail about associate degree. Bachelor of Science in Nursing is available in various colleges and universities. So these are 4 years. We also have Masters of Science in Nursing, and some colleges and universities offers these opportunities. And then we have doctoral degrees. Doctoral degrees, which is the terminal degree of nursing. So we do have Doctor of Nursing Practice. That is a terminal degree for nursing. It's pretty much new, so a lot of people don't know much about it. And we have ND, we have PhD, we have DN Science, and colleges and universities offers these opportunities. So now, if one wants to become a nurse, you have to assess yourself where you want to head. If you are somebody who just want to just go directly into nursing practice or just start working as soon as you finish school, or you just want a short period, you don't want to go through a long process, then you can choose LVN or associate. So LVN mostly they work in nursing homes. They can choose to work in other places too, but usually they work in nursing homes. An associate degree is community college. They take only 2 years and then you'll be done. And you don't have too much as compared to the 4-year university. So depending on which one fits you, you can assess your family, which one will fit your family, which one will fit you. But mind you that even if you choose to go to these 2-year colleges, you can still bridge later on. When you have started working, you can bridge into other schools to complete your bachelor's too. If you finish the Bachelor's of Nursing degree or the Associate degree, you have board exams to take. So after the board exams, you have to fill some forms for your license, and the licenses are based on each state's board. So you have to always refer to your board website to see the requirements and everything. So after the board, then you go hunt for your job, and that is where you look for a job. You apply to so many places. Don't limit yourself, and then you take the opportunity to work as a nurse. Now, many people think that only working at bedside or the hospital or nursing home is the only jobs for nursing. No. We do have various forms of jobs or places one can work as a nurse. One is education. One can just go into teaching if you are interested in teaching. You can be teaching CNAs, you can teach LVN schools, you can teach associate school if you have bachelor's. You can teach in the universities if you have bachelor's or the master's. And also, even aside the education field, some hospitals also hire specifically nurses to educate and train their nurses. So all those are the opportunities for nurses. When we come to administration, nurses have the opportunity to hold offices like managers, chief of nurse, directors, in so many ways. So nursing is not all about bedside or direct care of patients, but you can enter into administration as well. So you can hold office as a manager in a unit or outpatient clinic where you will manage small number of people. So let's say you go into outpatient clinic, you will manage the outpatient. If you are in a hospital, they assign it according to the unit. So you can be a manager of a unit, let's say med-surg unit, ICU, mental health. You can manage the whole unit as a manager. You can also hold a position as chief nurse. The chief nurse is overall boss, so the nurse managers are under them. So they, like when you go to the hospital, they will say all acute units, chief nurse. So the chief nurse will supervise all the acute units, med-surg, all those places. And then also, apart from administration, one can also go into other fields like midwifery and specifically nursing practice, nurse practitioners. So they are master's degree obtainers. So when you achieve your master's, you can select which specialty you want to achieve your master's in. Some achieve mental health or psychiatric mental health nurse practitioners, midwives, some also acute, and others family nurse practitioners. So you can go into nurse practitioner programs, and it's a master's program. So these master's programs, you can go into all these after you have obtained your bachelor's. So after the bachelor's, then you can obtain your master's in any of these fields. So when we take nurse practitioners, their job is like prescribing medication. Just like you go to the clinic and you see your doctors, they do jobs like that. So you see them, I know a lot of people are confused about who is a doctor when they go see their providers. But your provider can be a physician, and your provider can be a nurse practitioner. But we have classified physician, mostly layman term, as doctors, so they get confused when you introduce yourself as a nurse practitioner, because they think everybody in a court is a physician. So the difference is that we have physicians and we have nurse practitioners, but the doctor is somebody that have obtained academia in doctoral program, and that is when they are referred to as doctors. But many people don't understand it, so they refer physician and nurse practitioners as doctors. Okay, so we won't go there into detail because that will come in a different video. So there are so many pathways that one can go into, and that is another form is the nurse practitioner. So for the nurse practitioner, you can choose to be acute nurse practitioner, where you will work in the hospitals, or a family nurse practitioner, where you can work in a primary care, or you can work in a family care. And we have pediatrician too. They can be nurse practitioner that is specialized in pediatrics. So you'll be seeing all the children from birth to teenage. And also we do have midwives, and they also are they are specialized in birth delivery. And we do have the family practice, is one where you see all ages. Some can specify to see only adults, but you have the ability to see all ages. And we have adults. Some specialize in only adults because they don't like seeing kids, so they specialized in adults. And that is for nurse practitioner. So I have covered so many pathways as a nurse that one can go into, not specifically only bedside, but you can be an educator, you can work as administrator, you can work as a nurse practitioner, and you can work in diverse ways. So nursing is not only limited to bedside or passing only medication, but is broad. So stay with me. Remember to subscribe and share, and as we are educating others, so that you'll be able to choose which pathway to go as a nurse. So thank you for listening to me, and we will continue again. All right, you have a good day. I love you. Stay blessed. Bye.